You're back with the Newsfeed late night. Thanks for staying on. Botswana is set to probe the deaths of 2 people who received the AstraZeneca vaccine. The country has so far administered about 31,000 doses of the AstraZeneca vaccine. Joining me now to talk about this is University of KwaZulu-Natal Acting Deputy Vice Chancellor for Research and Innovation, Professor Musa Moshabela. Prof, good evening and thank you very much for your time. That question coming up again. Europe has been asking this question. It's Botswana now asking this question. Is there a link between the AstraZeneca vaccine and the development of blood clots?
Yeah, no, it's a question that I think we're going to continue to ask for a while. Greetings to you, Tabo, and to your viewers. The information from Botswana is very interesting in the sense that noticing the 2 deaths, they simply said that they're going to investigate. They are not necessarily stopping the rollout of the vaccine, but they did put in a caution for people who have severe disease to delay vaccination. Now, I wondered whether that is an explanation that they are leaning towards, that the 2 people who died might have been just coming out of severe disease or something like that. But I'm waiting to see what their report is going to be. In terms of the clots, I think we're going to take a long time before we know for sure if there is a causal link.
Yeah. The risk in itself, I mean, how serious is it, I suppose? And they are comparing it here in Europe with the possibility of getting a COVID-19 infection. When you weigh the 2 risks, which one weighs heavier?
Yeah, so let me put it this way, that COVID-19 itself has blood clots. And I'm not just going to talk about COVID-19 in general, but the clots in COVID-19. And for anyone who gets COVID-19, chances that they will get a clot from COVID-19 are 40% or roughly so. In some instances, it goes down to 20%. In some instances, it goes much higher. So anyone who gets hospitalized, it goes closer to 90% chances of getting clots. So you can see there that almost half of the people that get COVID-19 actually get clots. But then when you compare with AstraZeneca vaccine, we are estimating here that about 4 people in a million will get some clots. And for Johnson & Johnson vaccine, we are estimating, with the data we have, that about 1 in a million will get blood clots. So we can see there that the risk of clots with the vaccines is way much lower than you might see with the COVID-19 itself.
There seems to be some kind of relationship as well with age here of some sort. I mean, most of the cases, for example, reported in Europe occurred in women under 60. But if you're looking at Botswana, they're saying the 2 deaths were of elderly people. And how do you analyze that?
No, it's very true in terms of the data that we are seeing. I mean, it's really concerning that we have seen deaths with clots in younger people in Europe and in the US, and mostly some of the serious side effects. And here I'm talking about clots as well as the severe allergic reactions of anaphylaxis. And I should also say that the anaphylaxis, the severe allergic reaction, is also rare. It's estimated to be about 2 to 5 people in a million. But when it does occur, it seems to occur in women. I think we don't really fully understand the reason why, but it's something that I think scientists are trying to figure out exactly what. I was actually a little bit worried about the issue of oral contraceptives initially, but we don't yet have any data to suggest that there is a link, because the oral contraceptives themselves also have an increased risk of clotting.
Now, the real conundrum, I suppose, comes because when we talk AstraZeneca, the vaccine is the cheapest so far, most readily available, even though I know India has decided to halt and keep some stock for themselves at this particular point, seeing their numbers on their side are also rising. But also, it does not need to be kept in extremely cold temperatures, unlike all the other vaccines. So what would you say? I mean, should countries consider, even including South Africa, delaying getting the vaccine?
Yeah, no, I think it's important that we set this really straight. I think that we have to talk about these adverse events, Tabo, and educate people about them, but also put them, in the perspective of how rare they are, the serious side effects, and also the fact that we don't yet fully understand. There may be people who they may have occurred by chance. It may be people who have certain vulnerable factors that make them susceptible to blood clots. There may be a causal link with the vaccine for some people. We know that it triggers. There's a suggestion that these clots are happening because it triggers some antibody in that kind of induces this problem with the clotting in the body. So this may be isolated incidents, but we have to fully understand them. In the meantime, what we do know is that if we don't vaccinate people, people will get infected with COVID-19, and we will see severe mortality from that. It's not really an option. We have to vaccinate, but the question here is, how do we do it in a responsible manner? Basically looking at the options that we have available in front of us in terms of vaccines, how we monitor these adverse events, how we manage them, and also when they occur, even when they are rare. And then finally, as South Africa is doing, how do we compensate people who, unfortunately for, even though it's not desirable, they may suffer these adverse events. So that would be an approach to think about it, and not shove it under the carpet, but really be transparent about it.
Now, there is, of course, another report here that I'm looking at, and just quickly give us an update on what does it mean and how does one read it. AstraZeneca and St. Luke's Mid-America Heart Institute today announcing high-level results for the primary analysis from the DARE-19 phase 3 trial assessing the potential of Vaxiga, which is dapagliflozin. What is that treatment all about?
Yeah, so Vaxiga is a drug that was developed by AstraZeneca. I think it's about 10 years old, the company now. And it was basically tested for treatment of COVID-19 patients, because in one of the studies that was completed, it was shown that it can protect people from damage of critical organs in the body, including kidneys and heart and so forth, and from metabolic adverse events. And because a lot of people who might end up demising with COVID-19, they would demise because of this multi-organ failures, they wanted to try to see whether this drug could improve survival by protecting people from those organs. But they found in the study that there was no benefit. So it's another trial that was done with good intentions, but it didn't yield the results that were expected. The only thing that it yielded is for Vaxiga, it showed that it is still safe to use, because some people were saying that Vaxiga is unsafe. But otherwise, there was no benefit observed.
Professor Moshabela, I appreciate your time. Thank you very much for joining us tonight here on the Newsfeed Late Night. That is the University of KwaZulu-Natal Acting Deputy Vice Chancellor for Research and Innovation, Professor Musa Moshabela, giving us, of course, the latest on the AstraZeneca vaccine and the tests being conducted currently in Botswana.